Good. Welcome to True Health Tuesdays. Today we're going to talk about how the body works, but to fit how the body works into 30 minutes, that's impossible. So we're going to talk about the relationship of the nervous system. So that makes it a lot more sense. But first we got to figure out why, what's going on. Doesn't every doctor, doesn't every healthcare professional know how the body works? You would think so. If you bring your truck to a diesel mechanic and it happens to be a diesel, you would expect him to know diesels, right? Well, in 1960, this is really long ago. I was born in 1960. Still alive. No, does that seem like a long time to you guys? Okay. Well, the U.S. ranked 12th in infant mortality, and that means that we were pretty high. Not many kids in our country died. Well, now, about 6 per 1,000 die in this country. By 2015, we're 58. Now we're 77. So we're seeing that we're killing more kids in this country doing the practices. Now these are not kids raised in caves. Most of the births are in hospitals. Now, currently, 1 in 2 kids today has a chronic illness or disease. 1 in 4, dearly, is developmentally disabled. Currently, it's 1 in 45 that have autism, but, we have about 9 more years before 1 in 2 has. So we're doing something wrong. And then when you start looking at this, we're talking half the people are going to get cancer, 20% are going to get autoimmune disease, heart disease, liver disease, depression, dementia, thyroid problems, diabetic, congestive digestive disorders, or chronic digestive disorders. Just like for shits and giggles, what do all these conditions have in common? Should we be looking at each disease, or is there a consistent theme inside of each disease? Because what the medical system is looking at, they're looking for a cause of disease. And in fact, we got great specialists. They're called oncologists in cancer. We got great heart disease. They're called cardiologists. We've got liver disorders. They're hepatologists. Depression and anxiety, psychiatrists, psychologists. All those conditions have one thing in common: the nervous system. When you look at each of the systems in the body, and we're talking cardiovascular, reproductive, respiratory, endocrine, digestive, immune system, urinary, integumentary, musculoskeletal, all of these are connected to the nervous system. There's all some aspect of it. Now, the automatic or autonomic nervous system, we've talked about this before, but when we talk about how the body works, it can't be stressed enough. Okay, particularly when we look at this. Now, when I was teaching human dissection anatomy, I could actually have a cadaver here, open it up, do a little laminectomy on it. I could do a laminectomy in like 15 minutes. It was really fun. That sounds kind of gross, okay, but you just like pretty much a dead person's laying face down, you take a chisel and you go break all the lamina, and then you take it off and you expose this. So what you could do is you actually see the parasympathetic nervous system. It's right at the base of the skull and the sacrum. And you could take apart and show these nerves. And the sympathetic nervous system, it's located in the thoracic area in the top of the lumbar. So you can literally open this up and I could trace along these nerves. Now they have a function. One keeps you alive under stress and the other is rest, digest, and repair. And we're going to cover this intimately, but when you look at it, when one's up, the other's down. They both can't be up and they both can't be down. Okay, so we have to always look at the balance of it. Now, the fight or flight, or the sympathetic nervous system, it elevates your blood pressure, it elevates your energy level, it does everything to keep you away from danger. And this is absolutely imperative. This is what you get when you're driving down the road and somebody cuts you off. Your heart rate goes faster, your reaction time goes faster, your pupils dilate, your liver breaks glycogen down to glucose. Bam, you're there, you're okay, you're up for it. Then when the danger passes and then you get to the office, you can relax and enjoy, because offices are very non-stressful environments. Isn't that right? Yes, okay. Now, the problem with this, okay, I guess dropping this is not really good for it. Okay, the problem with this, don't drop automatic changers, is The entire system doesn't understand this. See, the allopathic model, and that's what we're using today, the doctors are not taught critical thinking, and they've developed this rigid belief system that the systems are separate, that they're not integrated. This is why the digestive disorders, the gastroenterologist doctor, who's a specialist in diseases of the gastric section, he's not taught nutrition. And he's not taught that in a chronic sympathetic dominant state, when someone's in that chronic state, that blood supply and nerve supply to the gut is decreased. So there's no way any drug or medicine or nutrition support or surgery is going to have an effect or positive effect unless you restore that parasympathetic nerve sympathetic balance. So what we're seeing here, I mean, this rigidity to the allopathic model is that people are dying. We have the sickest population on the planet. What's neat is this is the Dark Ages. You guys are going to be born in you're born in the Dark Ages, but you're going to the Renaissance, and that's totally cool because they're going to be the ones in charge. See, right now, imagine if the doctors and everyone else had an appreciation for the body. I mean, we get people in here all the time. Oh yeah, I've got a tumor and a cyst. Can my body, how do I get it removed? So, well, did your body build it? Yes. Well, if your body built it, he built it because a response to toxicity, deficiency, pathology, there's some reason that the body built it. And so the body produces interferon, it has a brilliant immune system. Tumors can go away too. And you'll see that in the literature that cancerous tumors, most of them spontaneously resolve. So now we've got this discovery where the body is more dynamic than what we thought. In this vitalistic concept, it's now come to fruition because we are. See, doctors are not, when I say they're not smart, that doesn't mean they're not educated. They're extremely educated in a system that does memorization and regurgitate. I mean, if you tell every doctor out there, okay, how many nurses and doctors here? Okay, if I said blue sclera, you'd say osteogenesis imperfecta. Okay, if you're studying for the boards, okay, I'll refresh you on congenital anomalies. Okay, so but I mean that's what they're taught. They're taught to memorize and regurgitate. I give you symptoms of, fever, red rash. Okay. In a 40-year-old, what is it? Oh man, I know like 4 things that cause that, and they get all excited. But they're not what causes it. It's which diagnosis. Do you know what I mean? So they're thinking that the disease actually exists. So when someone says high blood pressure, well, really, yes, high blood pressure. The cause is idiopathic, which means we don't know. So we can give a diuretic, a beta blocker, an ACE inhibitor. Do you know what I mean? And what happens to that? The population doesn't live well. So now this is the newest system, okay, and this is what I agree with, allostasis, that each system is not a rigid system, that all blood pressure shouldn't be the same, that all cholesterol shouldn't be the same, that all blood sugar shouldn't be the same, that the body is constantly adapting in order to maintain its integrity. Okay, that temperature is going to go up if you're exposed to a pathogen. The digestive function will be decreased if you're under physical, chemical, or emotional stress. You can restore sleep patterns. You can restore respiration patterns. All of those things are going to fluctuate depending on your awareness of the environment. And how does the body get its awareness of the environment? It gets it through the nervous system. This means that if you perceive danger, your sympathetics are going to be there. If you perceive safety, your parasympathetics are going to be there. So this is literally governs how you respond. Cardiovascular, digestive, respiratory, endocrine, everything responds to how you perceive your environment. And when you think, oh my God, that's incredible. Doesn't that mean that everybody with every illness, condition, or even if you're healthy, that you need to have your perception of the environment or the nervous system checked first? That would just make sense because it controls and coordinates everything. Now, the nervous system is so important, it's actually encased in bone all the way down. And what's amazing, this is the cross section of a spinal cord. And what we use, and this is kind of cool, I've got one of our patients I was working on today, and there was somebody observing, and I was using this to stimulate his brain. And so I go in there and I put a vibratory response or a vibratory stimulus into his body, okay, connected up to a bone, and I'm actually stimulating the dorsal columns because they respond to vibratory influences, and that's the top of the spinal cord of the back half of it. Then I went in there and I touched the coldness on his skin, and that actually is temperature. Okay, and temperature is on the side or the lateral spinal thalamic tract. And then I did light touch, I just rubbed it on him. And that stimulates the anterior aspect or the front portion of the spinal cord. It's called the anterior spinal thalamic tract. And so the person's looking and I'm going, yeah, well right now, since they have atrophy of the muscles, they can't stand up, they can't support themselves, I'm going to get a massive sensory input. So the brain is more aware of the body. Okay, and what was cool is, at first the kid couldn't even sit up, but afterwards, the kid was actually able to hold his head and sit up. They're supposed to say, cool. Because, you know, I'm not a musician, okay, but you know, knowing how the brain works. And that's one of the coolest things ever, that different sensation and different stimuli go up a different pathway. We've got a couple of patients now with actual bullet fragments inside of their neck, and parts of their body don't work. But there's still some amazing stuff where we can stimulate this spinal cord to actually bypass some of the injured areas so they can start to regain function. I mean, it's just so cool, so much cooler than anybody could possibly imagine. Now, then we go back to this. So the body reacts or responds to the environment based on its perception. It perceives the environment through danger, okay, protection mode, or growth and repair. And that's how we all are. I mean, if we say, oh yeah, we're not judgmental, yeah, okay, come with me, we'll go to downtown LA, we'll start walking down a dark alley at 8. Okay? You got any judgments there? Well, it's dark. You know, there's a lot of homeless here. I could probably buy some meth over there. You know, you're not going to want to go down the friggin' dark alley. But that's just common sense. Because what's going to happen? Your sympathetics are going to fire off. Blood supply to the gut's going to shut down. My God, you're shaking right now because you got so much glucose because the liver is breaking glycogen and glucose. You want to run down that alley or run over there and pick up the meth. Okay, yeah, bad example. Don't do meth. Okay, so, and this is one of the ways we check the autonomic nervous system. It's totally cool. This is called a heart rate variability. And what this is, like in the movies, you know how you see this blip, 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 okay? What that is it's called a QRS interval. And we measure the height, the width, and the spacing of that over a 5-minute time frame, and then tells us if you're sympathetic dominant or parasympathetic dominant. Now, mind you, we're doing this while a person's sitting, resting in a chair. So this is the trip part. If you have, so we have the sympathetic side here, we have the parasympathetic side here. These systems need to be balanced, okay, and so everyone should be in that green zone there. And that would actually make sense because that's how the system works. Now, this person here on the left, you can see that little white dot there, it's in the sympathetic side, extremely sympathetic dominant. So this is a person, let's see, what conditions would they have? Good digestion or poor? Yeah, diverticulitis. Okay, knowing that serotonin's produced in the gut. Do they sleep good or poor sleep? Poor sleep, happy or sad? Yeah, chronically depressed, okay? So they're anxious. Do they have elevations in blood pressure? Yeah, so are they taking blood pressure meds? Yeah. Elevations in blood sugar? Yeah. Beginning type 2 diabetes? They're none of those. They're in a sympathetic dominant state chronically. Okay, can you see how doctors, because they're not taught critical thinking, and the neurologist isn't taught about cardiovascular or, you know, all the other stuff. I mean, it's such a dysfunctional system. Now the center one is actually something that we see occasionally. It's called normal. Amazing. It blows me away. It's like, holy moly, can I take a picture of you? They actually came in, okay, with an idea, and this is really strange. They come to me, they waited 3 months to come in, and they wanted to get checked for, what's that W word? Wellness. Yes, wellness. They wanted to make sure they were okay. Makes sense. Now, this person on the right, you can see the white dot down there, is parasympathetic dominant. Now, this is frightening because not only is it parasympathetic dominant, but it's low functioning parasympathetic. And the literature on that is, because you would think that a sympathetic dominant would be more dangerous for what? Heart attacks, things like that? You'd be wrong, okay? In heart rate variability, and that's what what the test is that we're just looking at, Journal of Electrocardio. Now, they did this heart rate variability on diabetes, ischemic heart disease, and congestive heart failure. And what they found, and we're talking multiple studies, people with decreased parasympathetic activity by over 30%, the worst ischemia and the lower parasympathetic activity had more ischemic events. So we're talking more heart attacks. So when I looked at this, it was like, this is an extremely dangerous situation. Okay, what's the patient say? I feel fine. Okay, does anyone know the first sign of heart attack? Okay, I'll give you 3 choices. Is it jaw pain, left shoulder pain, or death? Close, you'd be wrong, but close. Anyone for the jaw pain? Okay, you're right, death. Leading first sign of a heart attack, death. Really hard to recover from. Okay. I know. 2 people have, 1 had help. Okay, so when we look at this, that's Bible joke, no Bible humor? Okay. How does it work? Okay, so how does the nervous system work? Well, remember that cranial sacral, the parasympathetic? You got 2 nerves that come out of the base of the brain there. So we're talking glossopharyngeal and vagus nerve. Now, it's decreased in parasympathetic that causes the heart issues, not the activation of the sympathetic. That's huge. Persistent decrease in parasympathetic because it decreases acetylcholine, nitrous oxide, cyclic GMP. And there's another study. So when you couple, and does anyone want to know the mechanism of how stress actually kills? Because granted, we're talking low functioning parasympathetic. And so the parasympathetic is like the diesel engine of the heart. It just keeps going at it all the time. If you have a low functioning parasympathetic, the heart is going to be racing and slow, because it's only going to be under sympathetic or that fight or flight activity. So you're going to have cardiac arrhythmias, things like that. That's going to be like a clue. Well, now, this is a patient here. Here's the right side, here's the left side. We're looking at all the spinous processes shoved over to the right side. Well, how the body actually works, like when I talk about left jaw, left shoulder pain, those are all common things that doctors are taught. These are signs and symptoms of a heart attack. Because if you irritate the diaphragm on the left side where the heart is, that's connected up or associated with the left trapezius. And that's going to link to left arm, left jaw, left shoulder pain. So if the heart is having trouble, it irritates that diaphragm, that's what it refers to. Okay? That's why, it's seen in the movies. Okay, and then they fall down. The liver is associated with the right diaphragm, which is associated with the right trapezius. This is why when real doctors are looking at the body and you have right shoulder issues, you got to ask them how digestion is. Okay, is it gallbladder issue? Is it liver issue? So here's the actual mechanism for how stress kills. Under stress and more stress and more stress and more stress, that right trap increases in tone. And the center of that right trapezius is the nerve supply to the heart, the sympathetic nerve supply to the heart. Remember, parasympathetic's up at the neck area and the sacrum, sympathetic's in the middle or the top of the thoracic area that supplies this. So T1 through T4, this is the sympathetic nerve supply to the heart. So how stress kills is these bones get pulled over further and further and further and further. Eventually, it gets pulled over so far. So, you're pissed off with your spouse, your job, you're frustrated, you're tortured in a prison camp. Okay, you're getting stress on top of stress on top of stress. Eventually, physical, chemical, and emotional stress reach their peak. It pulls it over, bam. Your body fires a sympathetic charge down to the heart, putting the heart in what's called ventricular fibrillation, stopping the heart. So, now let's say that you're a doctor that understands this nervous system, okay? This patient comes in, cardiac arrhythmias. They just got a scan, low functioning parasympathetic. You see this massive right rotation. Okay, what other doctor in the world is going to say, look, thank God you're here, because that is a heart attack waiting to happen. And that's him 90 days later. Centrally located, can you see this? And then of course you had clear scans. Now this is why the system, so how the body works. If I say that sudden death is even an intelligent response to, it's like the off button. When we've had so much physical, chemical, and emotional stress, this is how the body responds by shutting everything down. Okay, does that make sense? That even death would be an intelligent response given the chronic stress state. Now, lungs. Because also, think of this. Where was that parasympathetic nervous system located? Oh, the neck and that. So if you're a sedentary lifestyle or office worker and you're sitting on the sacrum and your head's forward, do you think that might alter or cause parasympathetic activity to be lower? Is that one of the reasons that sedentary lifestyles are linked to certain diseases? Yes or yes? Yes. Yeah, I know. It's so much easier when the teacher gives the answers. Okay, now, okay, so remembering stuff, okay, there's a lot of, the best way is dirty mnemonics. Okay, the one for the bones of the hand, okay, like, we're talking triquetrium, pisiform, hamate, okay. It's actually some lovers try positions that they can't handle. Okay, honest to goodness. Okay, there's some dirty ones, but go like this, earmuffs? No. Okay, so this one I'm going to teach you. C3, C4, C5 keeps you alive. And that means that the nerve to the diaphragm, the breathing muscle, comes out of the base of the neck. So does that mean that any pulmonary problems, or if you can't do that oxygen carbon dioxide transfer, what's going to happen to the heart? Okay, because the heart actually runs blood supply to the oxygen to get rid of carbon dioxide. And if your lungs aren't working correctly, what's the heart going to have to do? Increase. Okay, good. This was a clue. Thank you. Thanks. Okay, so when we look at this, the way that the body works is when you breathe in, the diaphragm comes down, and that's going to push the stomach contents out. When you breathe out, the diaphragm comes in, and then the air comes out. So this is how we do it all the time. When someone's being checked for high blood pressure, I'll say, okay, yeah, my blood pressure is really high. Do you understand have you ever checked the dog for high blood pressure? No, of course not, because the dog is smarter than any human being. He can self-regulate. Human beings are self-regulating too. If blood pressure is high, it means we're not getting an appropriate oxygen carbon dioxide transfer. Okay, does that make sense? So I say, look, sit the person down, have them deep breathe for 10 minutes. And guess how they're going to breathe? They're going to breathe like an American. What happens is when you breathe in, your stomach comes in, your chest goes up. And so they're going, okay, that's not human breathing. Watch any normal human breathing. Human breathing is diaphragmatic breathing. When you breathe in, the diaphragm comes down and your stomach comes out. So breath should look like this. I know, you're envious. You don't have a normal man's ab. It's like, hey, trolls, work another 30 years and you'll have one. It's great for demo, isn't it? Okay, so when you do that, I'll get people, honest to goodness, and I'll say, no, you got to breathe out, okay? Your stomach comes in. You breathe in, your stomach comes out. And so I'll have to train them how to breathe. I'll put my hand here and I say, okay, I'm going to punch you in the stomach. Now, what would happen if I punch you in the stomach? What do they do? Breathe in and push out. Blow out, push in. Breathe in and push in. Honestly, I'm not kidding. I do this every day with 4 or 5 people every day to teach them how to breathe and say, go home and practice it. Okay? Seriously. Okay, right now, look to the right, look to the left. Okay? Put one hand on your tummy. You better do this. I'm going to make a big scandal out of you. Okay? Now, take a deep breath in. If your tummy didn't come out, now blow out. Your tummy's got to go in. You breathe backwards, my friend. Okay, now let's look at the lungs, because the lungs are a bunch of grapes. They're a bunch of grape sacs called alveoli. Now this is where it really gets cool. The arteries get down to little tiny capillaries, so just one cell at a time goes through, and the cell, so they're one cell thick, gives up its carbon dioxide and absorbs its oxygen. And it does this because there's a really gentle lubricant called surfactant that lines these little grape sacs. Now, if you're dehydrated, you can't produce healthy surfactant. So if you're dehydrated, you produce a thick mucus. If you produce a thick mucus, is that oxygen-carbon dioxide transfer going to be able to occur? No. This is why people misdiagnosed with asthma have a poor carbon dioxide oxygen transfer. They have 10 times the amount of mucus in their lungs because they're dehydrated and they can't produce the healthy surfactant. Isn't that interesting? Plus, oh wait, we can't get away from it. Nervous system control of the lungs? Do pulmonologists study this stuff? Well, they sure as heck should, because the parasympathetic reflex loop, where is that? Okay, so we have the nerve to the diaphragm coming out of the neck, but the parasympathetic reflex loop, that's coming out of the base of the brain, innervates the lining of the bronchus and initiates bronchoconstriction. So what is asthma? Those bronchioles are constricted. So what do? They give you an inhaler. What is that? A sympathetic stimulus. They give you a drug that stimulates the sympathetics instead of looking at the parasympathetic control. How do we fix people with asthma? We fix the nervous system. Because what I tell the patients, and honest to goodness, I've done this before. I've taken cadavers diagnosed with asthma. I've taken the lungs out. I've taken people with no pulmonary diagnosis, taken the lungs out, and there's no physiologic difference. So I'm sitting here thinking in the dissection lab, asthma is not a problem of the lungs. It's a problem with the smooth muscle control of the lungs. And I go, oh my God, thank goodness I'm a chiropractor. No, I'm serious, because chiropractors are not back and neck doctors. Okay, that's what the public believes. We're nervous system doctors. So I'm thinking, my God, this is really cool. So now let's look at the digestive system, because this is just a rough overview of how the systems work. The digestive system is brilliant. Again, when you smell something, so you smell that broccoli, you smell that hummus, you smell those stuffed grape leaves, you smell that wild-caught Spanish mackerel that we had, okay, you smell that music. Oh, wait, no. You can't smell music. Settle down. Okay, well, what happens when you smell? So the brain initiates this. Once you smell something, your stomach produces a specific acid towards that. So lamb acid is different than chicken acid, different than broccoli acid. Now the food comes down through there and hits the stomach. Now when it hits the stomach, there's actually a huge amount of acid inside of the stomach. And there's chief cells that produce pepsin, parietal cells produce hydrochloric acid, and the brilliance of the pepsin, or the parietal cells, is hydrochloric acid burns all cells. So the cell is divided up into two things. One part spits out a chloride molecule, the other spits out a hydrogen molecule. So you got this hydrochloric acid forming outside of the cell. Yes, that's random, dumb chance. There is no intelligent design in the body. It just happened that hydrochloric acid forms outside of the cell, random chance. I'm sorry. I'm totally kidding. That is brilliant. There's an intelligent design in this. Really. Okay, so now what happens is the stomach lining is constantly being eaten up. So we've got these goblet cells protecting the stomach lining. Now when food hits this, there's a muscle on top of the stomach called the lower esophageal sphincter. Now that muscle tightens up under the presence, because we have sensors with acid, that if there's acid in the stomach, that muscle tightens up so the acid can slosh around and not get back up to the esophagus. So what is reflux? Reflux is not enough acid in the stomach. Reflux is when that acid goes up into the esophagus and you get that burning and you can't lay down. So isn't that a nervous system issue as well? Yeah. And that's also why when we're talking reflux, you don't drink any water during meals. You don't drink any water a half hour before, a half hour after. Why? Because you're diluting the acid in here. Then the sensors inside of the stomach aren't going to work right, and that's where reflux comes from. Or what if you're eating something and you're stressed? So does anyone want to have a good hoagie sub and then, while we're jogging? No, because you've got this sympathetic activity and you're looking for a parasympathetic response. That's foolish. No one would do that. Okay, so when we look at this again, we've got the stomach coming in here, and once the stomach digests it and breaks it down appropriately, it hits this duodenum, this little tiny circular thing. And when it hits there, there's sensors. Again, and this is for fat. Now this is where the gallbladder comes in, and the gallbladder is just brilliant. The gallbladder and the pancreas drain through the same opening in this duodenum. So once fat hits there, the gallbladder, which stores and concentrates bile, contracts and forces bile in there to emulsify the fats. Now this is hugely important, because what do we need fats for? Every hormone. And what are fats produced, or where do they go? A lot of them go to the liver to build cholesterol, and cholesterol is the greatest structure ever. It makes every glucocorticosteroid, mineralocorticosteroid, sex hormone. It's the outer layer of every cell. It's the main component of the brain. Cholesterol is vital. I mean, we are in the dark ages. This is why they give cholesterol medications, okay, to control cholesterol, because the doctor is obviously smarter than your body. I'm being facetious again. Okay, this is called sarcastic humor. Sorry. So, but now you might say, what happens if I've had my gallbladder removed? Well, you need to fire the doctor because he's obviously an idiot. But you have nothing to store and concentrate the bile. So now you got this bile that's slowly dripping inside the duodenum, and this is where a lot of duodenal ulcers can happen. Plus, you're going to not be able to break down the fats, so you have to increase your fats, or you're going to have hormonal deficiency problems. We get a lot of people in here all the time with hormonal imbalance. So they're taking the so-called bioidentical hormones, which are not bio and they're not identical. And do you know what I mean? So removing parts, we don't have spare parts. Now, the bile is formed, okay, inside of that gallbladder. Where bile comes from is you've got a spleen just off to the side of it. And this spleen actually checks every red blood cell, because red blood cells only last about 120 days. So each red blood cell, if they're good, it puts it back in the system so they can keep, carrying oxygen to the tissue and carrying carbon dioxide away. Anyone that's used up, it passes over to the liver, and the liver breaks down the protein constituents and forms bile. So where do gallstones come from? The blood. So when blood is chronically stressed because of stress hormones, this is why they would talk about the stressors that are associated with gallstones. Okay? And so the three big stressors are female, 40, and fertile. I'm telling you, isn't it cool, all the mnemonics that you remember? Okay, because that's how doctors remember. Remember, doctors aren't smart, they're just good at memorizing stuff. Okay, so where do gallstones come from? Somebody that's high stress, that's had kids, okay, over 40. Why? Because their blood is full of stress hormones, and that means when the spleen is processing this, more gallstones begin to form. And then when you look at this, I mean, it's such a brilliant system. The food goes through the duodenum, into the jejunum, into the ileum, and all this time, it's breaking down their different constituents. And the bacteria in the small bowel, in the large intestine, all break down that food further. So we need a healthy gut flora in this. Now we have the reproductive system. And this one here, again, it has to do with the parasympathetic and sympathetic nervous system. So we're talking about pointing and shooting. Okay, that's a pretty clear picture. what I want you to understand, because we've got the parasympathetic, okay, and the sympathetic. Where do the nerves originate? We're talking in the sacrum, because remember the parasympathetic, cranial sacral? So does this mean that people with sedentary lifestyle are going to have imbalances in the system? Absolutely. Absolutely. That's why we check not just the sedentary lifestyle, but unstable pelvises. What do people also have when they have a sacral problem in this area? Knowing that those nerves supply the pelvic floor. Bowel and bladder control issues, prostate issues, okay, leakage, okay, all of those things have to do with that unstable sacrum. So you get these people coming in here saying, oh yeah, I got a prolapsed uterus. Really, that's an unstable pelvis, okay? Really, I've got bladder control problems. I've got urinary control problems. I've got erectile dysfunction. I've got this and this and this. Stabilize the pelvis. Does that make more sense? And here's the mnemonic. S2, 3, floor. Keeps the ding-dong off the floor. Okay. I'm telling you, do the mnemonics help? If I said C3, 4, 5 keeps you alive, okay? Okay, get it now, okay. Reproductive system, okay. Guess what supplies this? The autonomic nervous system. I mean, when we're looking at this, when we look at the side view of a human or of a male, you've got the rectum right behind the prostate. So when you have fecal material moving by there, it literally makes the prostate work correctly. So now, what causes this? So we got the autonomic nervous system, sympathetic, parasympathetic, okay? So under chronic stress, we've got the physical, chemical, and emotional stress. We're talking 50% are under moderate stress of Americans. When we're talking chemical stress, this is insane. Okay, why? Because what do chemical stressors do? Do they also alter the autonomic nervous system function? Yeah, they do. In fact, no country in the world has half of these vaccines. No human being has ever been exposed to this. These are not based in science. There's never been a randomized controlled trial. How drugs are tested. I mean, if anyone's ever heard of how drugs are supposed to be tested, it's supposed to be a randomized controlled trial where you do a therapy group, a placebo group, and a control group, and you follow them for a period of time. That's how drugs are done. So that means that every time you see the drug commercials on TV for Vioxx killed nearly 100,000 people, and it went through that drug trial. Okay, you look at the diabetes drugs that are killing people, okay? They went through that drug trial and they still killed people because nobody knows what happens when these drugs get produced and sent on millions of people because millions of people do not react the same. Does that make sense? But these are not subjected to it. They're called public health measures, and so they're forced on the population, so this is a chemical assault. That is why everybody needs to see the movie Vaxxed. Now, this, when some people say, well, vaccines, it's controversial. You know, it's been proven safe and effective. They don't cause autism. Because the CDC in 2004 did a study, and they proved beyond a shadow of a doubt that the measles, mumps, and rubella wasn't linked to autism. However, this guy, God bless him, Dr. William Thompson, came through, one of the lead scientists on the study, and said, look, we lied. We lied. Okay, we hid the data. It absolutely does cause autism. We lied. Okay, he's a whistleblower. He's never going to be put forward Congress. Do you know why? Want to know why Congress will never call him? Because when this study came out at the vaccine court, there were 5,000 families with damaged kids waiting to be heard at this vaccine court. 5,000. Now, you're talking, if the government actually admitted it, that these cases of autism were caused by the vaccines that were forcing them, were mandating, okay, that would have been trillions and trillions of dollars worth of payouts. It would have literally wiped out the economy. So they had to falsify the data. They had to falsify the data. So if you think they're safe and effective, see this movie, share this movie. This morning, One of our patients, God bless her, she's a pediatrician. Okay, she's been a pediatrician since the 80s. Loving, she loves kids. Every time I got a kid patient in here, she's all over saying, oh, cool, can I watch you, take care of him? And I gave her the movie Vaxxed. And she realizes when she started in practice in the 80s, there were no autistic kids. And she realizes now that she was forcing her patients to get the vaccines because she was told that the vaccines were safe and effective, and she actually caused autism. Can you imagine that? Can you imagine actually loving kids? I know you guys are cool, but I mean, some kids aren't. Okay, I can imagine loving you guys. You rock. Okay. But you don't want to harm them. And that was her job, and she had to admit to herself. So please share this, vaxthemovie.com. Watch it, share it, because what we're doing, we're causing inflammation. There's two immune system responses. Th1, which involves the gut flora, and this is how normal immune systems are working. Th1 is how we're exposed to viruses, and this is how we develop cellular and humoral immunity that we pass on to generations. What we're training people now is with acute inflammatory responses. So this is something that the nervous system is going to be put in a stress state. So what does that mean? Okay, we're going to have more diseases. Like, let's just say we're looking at just the hepatitis B vaccine. Now, this is the first one given at 12 hours old. Okay, now hepatitis, that hep means liver, itis means inflammation. So hepatitis B, we're trying to stop liver inflammation, okay? Okay, or a disease that causes inflammation of the liver. Increase the incidence of liver problems in U.S. children up to 6 years old by almost 300% versus unvaccinated controls, Journal of Epidemiology. So we're given a drug, force giving a drug to kids, or a public health measure, a vaccine, and it's increasing what we're trying to prevent by about 300%. I know. Okay, hepatitis, gastrointestinal disease, liver function test abnormalities. Hepatitis B alters gene expression. Hepatitis B in boys are 3 times more likely to develop autism, Journal of Toxicology. Hepatitis B increases the risk of multiple sclerosis, Journal of Neurology. Autoimmune neurologic conditions, transverse myelitis, Journal of Lupus. Hepatitis B significantly increases a wide range of autoimmune diseases, Journal of Autoimmunity. In the U.S., highest number of Guillain-Barré cases are associated with influenza and hepatitis B vaccine. This is not safe. It's not safe. So how the body works, this is not something the human body was ever designed to deal with. This is a foreign entity subjected in. Now we look at the main ingredient, or one of the most popular adjuvants. This is almost virtually every vaccine, is aluminum. Now, aluminum can alter DNA gene regulation, gene expression, damages cell membranes. When we look at the effects, and this is out of the current medical chemistry, vaccine benefits may have been overrated and the risk of potential adverse effects underestimated. I mean, that's absolute. Studies have not been done. Remember that list I just showed you of the 69 doses of 16 different vaccines? Studies have not been conducted to determine the safety or efficacy of administering multiple vaccine doses in a variety of combinations as recommended by the CDC. This is an inherently corrupt program, and we're forced in California to comply. I mean, it's mind-boggling. Okay, the aluminum adjuvants, all these findings, we're talking the Journal of Toxicology, implicate aluminum adjuvants in pediatric vaccines has causal factors, not contributing, causal factor to the rates of autism. Journal of Lancet 2002, do we have a rise in cancers? 1 in 2. There's no animal species on the planet that has 1 in 2 cancers, okay? I mean, if we had a caribou, half the population of caribou are going to get cancer. We would go up there and say, what the heck are you feeding the caribou? What's happening to it? We wouldn't say it's bad luck or bad genes. So when your friend comes up with lung cancer, brain cancer, bone cancer, lymphatic cancer, non-Hodgkin's lymphoma, you go in there and say, when did you have the polio shot? When you were a kid? Well, it took 40 years to develop. This is where I love my kid patients. About 1/3 of our practice is under. This guy's got an attitude, and I love him for it. Came from Colorado with ulcerative colitis, and imagine You know, you're 8 years old. 3 of your 8 years on this planet, you're pooping blood every time you go poop. You have no energy. You're just being destroyed. And yeah, that is one of the effects of vaccines. Fully vaccinated, multi-antibiotics, because what happens in this stupid segmental system, they're not saying, wow, you have ulcers in the colon, you must be in a stressed state, we got to change that sympathetic to the parasympathetic. They're not saying we got to help the bacteria in your gut, we got to give you more probiotics. No, what do? They give an anti-inflammatory, then they give an antibiotic, then they give a steroid, okay, to just decrease inflammation. I mean, please, if I had a pitchfork here, I'd run to Colorado. I mean, these guys are supposed to be experts in human. This parent is trusting him to go there. Okay, and I think it was 2 days. Yeah, 2 days when he came here, got him adjusted, got him on healthy juice, and the bleeding stopped. It's been a year now. And I actually used him in one other health talk. And I said, buddy, I want to tell your story because I think it's really powerful. And, but I can't use your name. I want to come up with a name for you. So, what do you want to be called? Nacho Business. I said, no, dude, I'm going to be telling a lot of people about this, okay? Come up with Mark or Barry or, no, Nacho Business. And okay, that's Nacho Business. He's like 9. If you look at this, and this is B.J. Palmer, one of the greatest philosophers of our time, medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. And why is that important? Because listen to this. Every doctor, your body is self-healing and self-regulating. Bam, right there. Every doctor's taught that, but none of them think about it. If they did, they wouldn't be given a blood pressure, cholesterol, or diabetes type 2 medication. They'd say, oh my God, your regulatory system is not broken. Your body's responding correctly given environmental stimulus. We have got to get you to the chiropractor. Okay, so the body is more energy than matter. That's true. Your thoughts control things. Your thoughts, your emotions are chemicals secreted by how your brain perceives the environment. So if your cells are in a consistent thought pattern or consistent chemical assault, your body's going to respond to that. Your health is your natural state. By God, if people knew this. No one's looking for a lack of ease or a dis-ease. We get a lot of people better, but that's only because we're getting them to normal. Honest to God, that's all we do. Health is the natural state. You have the right to informed consent to anything done with your body. Oh, I should have wiped that out because that's not true in California anymore. It's not true for most of America either. Okay, so we're losing informed consent. So this is the keys on how the body works. So when we talk how the body works and I say the nervous system, can you see how important that is? Yeah? Vital. Exercise, nobody needs to adjust 150 people during the day. That's a bit much. Yeah. Half-hour walk in a day is cool, okay? Proper nutrition, this means you don't eat stuff soaked in glyphosate, you don't eat stuff that's commercially produced that's toxic. Healthy food, sufficient rest and prayer and meditation. Oh, just for shits and giggles, I went up, and I looked up informed consent on the National Library of Medicine and the National Institute of Health.gov. It turns out that most vaccines require informed consent, and by law, your healthcare provider must explain your health condition and treatment choices. And you're supposed to have the right to say yes or no. We're one of the only countries in the world, that's right, China, Russia, I'm not sure about North Korea, but none of them require vaccines for employment or for education. Okay, only in the militarized state of America. Now, any questions? Yes, sir.
So within 24 hours, what is the proper balance between a sympathetic and a parasympathetic? Like 50-50 or?
Oh, if you gotta figure 24 hours, it depends. What's the standard 24 hours? What was your 24 hours like Saturday? Okay. What was my 24 hours like Sunday? And that's the cool part. It's going to be always up and down. There is no standard. That's why in that homeostatic model, everyone's looking for the normal. And if you're not normal, by God, we're smarter than your body. We're going to bring it down. There is no normal. The key is to look at how your physiology is progressing. If you have 3 bowel movements a day, that's appropriate. If you wake up and you feel refreshed and vitalized, that's appropriate. If you feel good, like you have appropriate thoughts and actions, and you're excited about life, and you actually feel really good. You know, I'm not talking about occasional aches and pains. Those could be because you were run over by a car or dropped off a building. Don't worry, babe, I'm still okay. You know, I mean, we're going to have traumas throughout life. It's going to cause occasional things. But by God, if you're pooping correctly, you're eating correctly, you feel good, and you have energy, that's normal. Anything other than that is not normal. Okay? That's a good gauge.